Women are the custodians of life. They bring forth new generations which form the most critical source of the nation. It's human capital. Women are thus the mainstay of the Kenyan and global economy, a critical national resource whose invaluable contribution is hard to put a price to.
We are looking back just to see how Kenya Medical Women has shaped the policy of healthcare provision, but particularly focusing on women's health. And in this instance, we will want to focus more on reproductive health.
In the face of this hardship and challenges, there are those who will not take these matters lying down, and they're on the front line of the charge to improve the lot of the Kenyan women economically, politically, and socially, creating robust institutions to champion for the better welfare of women. One such body is the Kenya Medical Women Association. The Kenya Medical Women's Association, KMWA, was established in 1983 as a membership organization for Kenyan female medical doctors and dentists with an initial membership of just 12. All of them distinguished Kenyan ladies who made up the first crop of female indigenous Kenyan doctors and others in positions of power and influence.
I attended a conference in 1980 in WHO, and I was a medical doctor with a specialization in public health. And when I was in that conference in 1980, a woman from Europe came to me and said, I didn't even know that there are medical doctors in Kenya. So by that time, we were quite many. We were over 100, I think. So I said to her, no, we are there. Then she told me, do you know about the Medical Women International Association, MWA? I said, no. She said, no, we have an international organization that brings all medical women together.
This was about 11 years after the first graduates of University of Nairobi. I have the joy in that I was among the first ones to qualify in University of Nairobi in 1972. At that time, only about 5 to 20% of medical classes were made of women.
For these ladies, despite the fact that they held a relatively privileged position in society, they still faced immense challenges.
So even when the women became doctors, they were not allowed to do certain specialities, such as neurosurgery, in fact, general surgery. So it was for that. But as time came, we wanted to interest young girls in high school to join the profession.
The association is an independent, non-governmental and non-profit making organization registered under the laws of Kenya. It seeks to uplift the health status of women, adolescents and children in the country by enhancing the capacity and potential of medical women to respond to various medical needs. The organization has the overarching vision to become an association of excellence, providing leadership in all matters of health, while its mission is to champion for the improved health and dignity of society, particularly vulnerable groups through a cohesive, professional membership committed to the core values of excellence, integrity, and compassion. In this drive, they drew on partnership from all sectors of society. This journey of more than 30 years has seen KMWA grow steadily as it strives to meet its objective of contributing to the betterment of health services, especially reproductive health. Among KMWA's objectives are to contribute to the betterment of health services in Kenya, to afford opportunities for medical women to confer and take necessary action on matters relating to the health and well-being of the various communities they serve, to provide a means of communication between medical women in different parts of the country and the rest of the world, and finally, to offer mentorship to young girls as they enter into medical and related professions. Prior to 1988, the Ministry of Health in Kenya had not taken any concrete steps in establishing preventive programs for conditions facing mainly women, like cervical cancer.
There was really very few people screening for cervical cancer. In fact, it was only being done at Kenyatta National Hospital in the Obs and Gyne department, and it was being done by pap smear, cytology, and the results would take a long time. Sometimes they get lost. By the time you get the result back, the patient is already dead.
Which is sad because it's a preventable disease. Now we know enough about cancer of the cervix that it's a preventable disease.
According to the U.S. National Center for Biotechnology Information, of 493,000 new cases of cervical cancer diagnosed in the world each year, 80% occur in less developed countries. East Africa has among the highest cervical cancer incidence and mortality rates in the world. The human papilloma virus, or HPV, which causes cervical cancer, is a sexual transmitted infection. KMWA has been at the forefront of breakthrough research to isolate and identify the virus.
And actually, KMWA was the first in the country to introduce the visual methods of screening.
The uptake for screening has remained very low, anywhere between 3 and 5%. And over the years, it has not changed. So we set out to look at what women know about breast cancer and about cancer of the cervix and family planning services, and how that information informs their health choices. So that particular research was very informative because it told us what information women have, what sort of services they would want to see in place.
That notwithstanding, KMWA has been almost solely providing those services for quite a long time before development partners through different agencies like JPIGO, ICAP, PATH, and so on, then decided to procure. And that was in 2000. That is when PATH started the Western Kenya Cervical Cancer Prevention Project, which actually the experts that went to help them to pilot that project were KMWA members and former staff of the Kenya Medical Women Association.
For a very long time in Kenya, reproductive healthcare services such as family planning, sexually transmitted infections treatment, HIV/AIDS prevention and counseling, and health education were not integrated as they were provided at different places by many different providers, making it difficult for women to access comprehensive reproductive healthcare.
We are looking at a situation where a woman comes and can get whatever service, like in a supermarket, you pick whatever you need. So she can come to this health center and pick whatever service she may need. Of course, issues of sexually transmitted diseases, family planning, name it, whatever she needs.
This is how the Well Woman Clinic was born in 1990, with the first center at Nairobi West, a one-stop shop to provide healthcare for women by women at a place just right for women.
Our Nairobi West facility at that time, we felt, was a middle ground. A woman came and requested for a breast exam, she could get it. If she had a lump, we could get a biopsy for her. If she wanted a pap smear, she could get it done. She could have a consultation with a gynecologist.
And that's where we saw like education and economic empowerment, all those activities have a big role to play in improving the health of women.
It became apparent that we need to validate what we call the syndromic management of sexually transmitted infections. And at that time, there was only one clinic in Nairobi that used to treat sexually transmitted infections. If you remember, it was called the STI Casino Clinic. And everybody with a sexually transmitted, what was thought to be a sexually transmitted infection, would be sent there.
The clinic in Nairobi was a first such clinic before the concept was replicated by others, including private healthcare providers and other hospitals in the country. Today, the Well Woman Clinic has grown from its humble beginnings to now offering comprehensive gynecological and obstetric services.
KMWA happened to be the first to introduce the concept of a clinic where well women come and have their bodies checked.
We need to have services available, affordable, and at a distance that a woman can easily cover.
In order to make this clinic, KMWA got support from European Union, University of Ghent, to procure the first cryotherapy equipment and the first LEAP equipment and their accessories for the country. And with that, KMWA got support to have world-renowned experts come and train a pool of gynecologists to start providing these services in the country.
KMWA members participated in the launch of the Savarix vaccine. However, despite their efforts, majority of women and girls did not have access to the vaccine due to various factors. In this new setting, with new prophylactic HPV vaccines launched, it still remains out of reach for many. The vaccine offers hope for preventing a large proportion of cervical cancer cases because the potential protection from HPV vaccine can offer benefits when other preventative screening options are largely unavailable. KMWA is a leader in innovation, research, and development, particularly on women health issues. KMWA continues to work hand in hand with government and provide entities developing and rolling out new medical innovation.
We are glad to report that at the moment as we speak, cervical cancer actually has a dedicated budget line in the national budget. In that respect, KMWA has done quite a lot in terms of promoting the welfare of women and addressing this cancer, which is the top cancer that affects women of reproductive age in this country and is the top cause of deaths from cancer to women in this country. And as a result, we are hoping that we are going to start seeing a declining trend.
KMWA has been involved in community outreach programs to create awareness and offer healthcare services to women, children, and the marginalized in society. The collaboration has since grown, with many corporates coming on board to help make a mark in society. One outstanding example is a medical facility at Nairobi's deep sea slum.
Majority of the women come to this dispensary to seek for treatment for other diseases, but they don't know that they might be harboring some of the chronic diseases. Can we check your blood pressure?
The medical camps and caravans have time and again proved a lifeline for various lucky beneficiaries. One of these lucky few was Millicent, a beneficiary of one such free medical outreach program. Millicent's visit to a free medical camp held by KMWA at the deep sea slum in Nairobi is the reason she is alive and well today.
Kulikuwa na mtangazaji anaitwa Esther Ingolo. Siku moja nikasikia akisema asubuhi, akasema anataka wamama 100 wale wanataka kufanyiwa pap smear na watume ujumbe. Kimchezo mimi nikatuma ujumbe. Ilikuwa ni 2011. Tukaenda mpaka 2012. Dr. Monda kanipigia simu. Kaniambia, Millicent, tafuta nafasi kuja kwa ofisi yangu. Akanipatia sekretari wake. Tukaenda nao St. Mary's. Nikapelekwa kwa Dr. Maina, ule gynecologist mwenye alikuwa amenipima. Gynecologist akaniambia, Millicent, results yako imetoka, but hii sasa hakuna njia ingine, ni operation.
We ran a medical camp for them and included pap smears as part of the services being offered. And we also provided services to the women from the slum. It's called Deep Sea Slum. Now, out of that is where Millicent actually was found to have an abnormal pap smear. She was referred to the Well Woman Clinic here. Now, because it was a medical camp, I actually insisted on doing the pap smear again. So I did it myself. It came back abnormal. She actually had carcinoma in situ.
Millicent underwent a hysterectomy and was cured. Radio Maisha funded her treatment through KMWA. There are many more women like Millicent out there, many of them not as lucky as she has been. Across Africa, many pregnant women develop pregnancy-related complications but do not have access to new technologies such as ultrasound scans that make diagnosis easy.
In women, we are so careful because it has to be justified. And we do a lot of imaging of the abdomen, especially if you are suspecting things like cancer of the uterus or cancer of the ovaries.
KMWA collaborated with Philips Medical Systems and was able to avail scanning services to marginalized women in Mathare, one of Nairobi's slums. Access to this kind of advanced technology was a first for most women that attended the medical camp at Mathare.
I just saw people seated here, so I came to confirm. Then I was told that they are doing this scan here. Yangu ni ya miezi 6.5, nimeundergo problem search. Yani I guess nilianza shindano mapema. Sasa zile miscarriage. Sasa hii niko poa, nikaenda kapigwa picha, nikaonekana kila kitu kiko poa. Sasa sijui ni ilikuwa ina nini? Ilikuwa inafanya, lakini sasa hii ndio nimekuja kuangalia nione ama iko poa.
This outreach had many positive outcomes, providing a lifeline for many women who would otherwise have succumbed to pregnancy-associated complications.
As much as we all advocate for pregnancy, we love to see pregnancy, we love children, but we also want a healthy mother and a healthy baby.
FGM has been outlawed in Kenya, yet many communities still subject women and girls to this harmful practice.
Female genital mutilation, which is quite common in Kenya, in some parts of Kenya. It's common in Somali community, common in Maasai community, common in Kisii. About 90% done in those communities. Reproductive organs also have functions, but in female genital mutilation, those organs are removed, leaving the woman vulnerable to infection, to anything else.
So the pain that's associated with FGM or FGC is not only at the time when it's being performed, you are subjected to cyclical urinary tract infection, difficulty with the passage of men's flow because you have closed off the top of the perineum. First, the cutting is done with crude weapon, maybe sharp stone, maybe cut glass, maybe scissors, maybe scalpel, even a kitchen knife. But the main one that set people whirling is bleeding, because the genital area is full of blood supply. In reaching out to organizations such as Maendeleo Wanawake, National Council for the Women of Kenya, we can reach many women, their husbands, the aunties of the young girl to be circumcised, because they're the one that influence the girl child. This is good for you.
Gender-based violence and HIV are inextricably linked. Physical and sexual abuse leads to health problems and hinders women's ability to negotiate safe sex.
According to the recent study, they showed that about half the population has ever experienced gender-based violence. Right now, we still have a lot of work, and maybe KMWA can come in and really assist in reaching out to counties, because many counties actually still lack gender-based violence services. Common cases who present to hospitals is sexual violence, and that's not just to women, to girl children and boy children as well.
Many women go through that. Many. Those who do these jobs of vibaruas, go and fua, many go through that. And so if you're a woman and it has happened to you, just go to hospital. It's one place that no one will point a finger at you and say that what were you wearing, mbona uku scream, you are cast.
A lot of advocacy, sensitizing community on GBV, how even at the community level to start some initiative of taking care of their own.
The World Health Organization has described obstetric fistula as the single most dramatic aftermath of neglected childbirth. It remains one of the most serious and disabling complications of childbirth, which has virtually been eliminated in developed countries, but is still prevalent in the developing world.
It's an injury that occurs during childbirth most of the time, but there are a few other causes that lead to leakage of urine or stool or both from the birth canal. There are very many other organizations that help us, and KMWA is one of the ones that helped us a few years ago. And they gave us the money to Kenyatta Hospital to assist 30 women who had this condition.
I didn't imagine whether one day I could run, do something, visit friends, go back to workplace,
So from there, they went, I was taken care of. I was given much encouragement on the same. And I promised and even vowed and said, regardless what time, what place, I'll be available to save another fellow women. We must understand that some facilities for women to deliver are still very far from their homes. They may go to the smaller facilities initially, which are nearer, which may not be able to take care of their problem. Then they are referred to other, higher level facilities. So by the time they go from one to the other and reach the facility that really needs to take care, they may already have developed what we call obstructed labor. The prevention for a fistula, which is most prevalent in this country, is from obstructed labor, is to have care of women in hospitals or in facilities where they can recognize that labor is not proceeding well. She requires a surgery. We are either able to do the surgery in this hospital or we need to refer her to the next level. So there should be a good mechanism of transferring. There should be ambulances available. Everything in the facility should be working, theatre, doctors, nurses, equipment to do that cesarean.
KMWA recognized that being a leader in the provision of reproductive health services, it was strategically positioned to influence formulation of policies that promoted provision of youth-friendly medical services.
In partnership was a project for adolescents. We felt that young girls actually do not have access to information and services. These are young girls, early teenage girls, who were dropping out of school because of pregnancy. Of course, we know pregnancy is not the only thing that we are worried about. There's pregnancy, there's sexually transmitted diseases. And we feel that really we, Kenya Medical Women Association, need to highlight the need for young women to actually have access to services. We feel that there was need to have clinics that were friendly to young people. It was more really for sensitizing our members, because our members are there all over the country. So wherever they are working, so that they know that adolescents have a special need. And what we had thought was every hospital would probably have a section where they provide services for young people, separate from the older people. It's not something we have yet achieved.
The KMWA has also looked beyond Kenyan borders, seeking international affiliation and engagement. It has been also very active in the local and international arenas on matters of population and reproductive health.
We as medical practitioners, and especially we as women medical practitioners, need to be in those spaces where the decisions are made about how our society runs, how our economy is, and how our politics make the decisions that impact on our lives.
One of the biggest events during my active days in KMWA was when we had a conference. We called it Child Abuse and Neglect. We wanted President Moi to come there because till then you could not, as journalists or anybody, report child abuse. And we had diplomats, we had UN agencies, everybody coming. And from that day, journalists got a go-ahead to say, yes, there is child abuse in Kenya.
And from that time, we challenged the media to report on cases of child abuse. And for many years, there wasn't any day that we didn't have a report. What a terrible thing to be proud of.
This led us to get involved with United Nations into enacting laws for children, which is one of the biggest things KMWA can be proud of.
I remember that cold morning when one of those senior members of the association looked at the letter and they thought, what, policy? Influencing policy from a gender perspective? And what on earth is gender? Do these people know that we actually cannot get a week to go out there on a training? But then she looked up and there I was just trying to struggle with one of the programs, and she says, you know what, Angie? you look like you don't have much to do around here. Why don't you go and see what this is all about? It transformed my life.
Shaping the policy and looking at laws and making the enabling environment for these programs to take place has been a pride for Kenya Medical Women's Association. I must pause and say there's still a lot to be done. We're now calling upon the Gender Commission to do more and to invigorate the women's movement in Kenya so that we continue to shape the agenda of women's development, but particularly also in women's health.
Today, KMWA continues to participate in both local and international policy formulation and advocacy. 39-year-old Nalianya Topista is in the third day of difficult labor. Tens of miles from the nearest health facility, this is her 7th pregnancy, and despite the onset of labor, there are no signs that it will be over soon.
I had the opportunity to experience these 3 delays. In one of the health facilities where we were helping give services, a woman by the name of Nalianya was wheeled into our presence. Nalianya was a 39-year-old and she was expecting her 7th baby. Nalianya had been laboring for 3 days at home while her mother-in-law was delivering herbal concoctions with the knowledge that, well, Nalianya had actually delivered 6 other children. So this 7th one should also actually be taken care of. We recognize that this long delayed had finally had a repercussion in that the baby could not be saved because a complication of pregnancy had occurred. Nalianya had ruptured her uterus. We could see just by looking at the belly that this fetus could not be saved. But Nalianya was there and we could have saved her. We quickly got into action. We organized for the theater to be prepared and ran to theater in order to be able to save her. But as we were going to theater, we were informed that, you know what, we need blood, and there was no blood. The anesthetist could also not deliver anesthesia. And therefore, by the time we got to theater, another delay had taken place. Unfortunately, we also lost the pulse. Nalianya lost her life. This is unacceptable. No woman should die while giving life. This is the kind of campaign that Abantu, in collaboration with the Kenya Medical Women Association, are doing.
The most valuable resource to this nation is population. Women must not be left to die alone. Not 8,000 women per year. Nalianya must not die.